Good morning, viewer. Welcome to our first TV. Here is a breaking news. Yes, the worst variant. What is this? Nearly 2.5 years since the coronavirus pandemic began, the most infectious and transmissible variant yet has arrived. Repeated COVID 19 waves have left millions of people dead, with only vaccines helping to blunt the toll. Now the virus is spreading again, evolving, escaping immunity, and driving an uptick in cases and hospitalization. The latest version of its shifting BA.5 is a clear sign that the pandemic is far from over. The newest offshoot of Omicron, along with a closely related variant BA.4, and fueling a global surge in cases, 30% over the past fortnight, according to the World Health Organization. In Europe, the Omicron subvariants are powering a spike in cases of about 25%, though Dr. Michael Ryan, the executive director of WHO's Health Emergency Program, has said the number may actually be higher given the almost collapse in testing. BA.5 is on the march in China, ratcheting anxieties, and major cities there may soon reinforce strict lockdown measures that were only recently lifted. And the same variant has become the dominant strain in the United States, where it accounted for 65% of new infections last week, according to the Centers for Disease Control and Prevention, that is called CDC. We have been watching this virus evolve rapidly. We have been planning and preparing for this moment. And the message that I want to get across to the American people in this BA.5 is something we are closely monitoring, and most importantly, we know how to manage it, said Dr. Ashish Jha, the White House COVID-19 response coordinator, in a news briefing on Tuesday. On the same day, WHO's emergency committee said COVID-19 remained a public health emergency of international concern, its highest level of alert, first declared on January 20, 2020, amid rising cases, ongoing viral mutation, and increasing pressure on already overstretched health system. In a statement, the committee, which is made up of independent experts, highlighted challenges to the ongoing global COVID-19 responses, including a drop-off in testing and spotty genome sequencing, raising the question of just how accurately any nation might reasonably be able to monitor BA.5. Official data dramatically undercount the true number of infections in the US. Epidemiologists say, leaving the nation with a crucial blind spot as the most transmissible coronavirus variant yet takes hold. Some experts think there could be as many as 1 million new infections every day in the broader US population, 10 times higher than the official count. As for how to manage the new wave, Jha urged Americans aged 50 and older to get second booster shots. Adults who are up to date with vaccination are less likely to be hospitalized than those who are unvaccinated. But only about 1 in 4 adults in the US over 50 have gotten their recommended second boosters, data collected by the CDC show. US health officials are urgently working on a plan to allow second COVID-19 boosters for all adults, a senior White House officials confirmed to the reporter on Monday, amid fears that younger adults' immunity may be waning as COVID-19 cases rise with the dominance of BA.5. The Omicron variant of coronavirus has mutation that change the spike protein on the surface of the virus. These mutations could allow Omicron and subvariant of Omicron to evade the body's immune response, making vaccines less effective. Eric Topol, a cardiologist and professor of molecular medicine in Scripps Research, has called BA.5 the worst version of the virus we have seen. He explained in a recent news shelter, it takes immune escape, already extensive, to the next level, and as a function of that, enhanced transmissibility well beyond earlier versions of Omicron. In other words, BA.5 can easily evade immunity from previous infections and vaccine, increasing the risks of reinfection. Though the variant does not appear to lead to more severe illness. In an interview with the reporter on Monday, Topol said that given the extent of BA.5's immune evasions, he expects to see an escalation in hospitalization as we have seen in Europe and elsewhere, that the variant has taken root. Yes, one good thing is it does not appear to be accompanied by the ICU admissions and the deaths as previous variants, but this is definitely concerning, he added. Public health experts in the US may take some solace from the trajectory of the variant in Europe. Subvariants of Omicron like BA.4 and BA.5 continue to drive waves of cases, hospitalization and death around the world, WHO Director General Tedros Adhanom Ghebreyesus said in a media briefing on Tuesday. Behind the report, Fosak TV.